Well, I think, health is a very integral part of all of our lives. And of course, without good health, it's really difficult for us to go to work every day. And so if you're not able to go to work, then that certainly affects the economics. And so I think that what I bring to this organization is an ability to look beyond the health, to look at those social determinants of health, housing, food insecurity, economic I'm sorry, looking at how can we get economic mobility for those individuals in the community? How can we address transportation needs? So those are things that I think about even in my current role at the Cone Health Foundation. I am more than just looking at the pure sense of health, but looking at all those social determinants, those social drivers. And so I think that dovetails really well with what United Way has been doing, because we're looking at how can we get people from just surviving to actually thriving. How do we get them up that economic mobility roadmap? And then also, how do we address the critical housing issues that are in place? And how do we look at how place has impacted people's lives? How can we get to a place where, regardless of where you live, you have access to all the resources that you need to be successful here in Forsyth County? The main issue is, yes, poverty has always been with us. And that said, we have thrown money at poverty, but we have to now get to the root causes of it. If we're going to truly affect change, we have to think about systems change now, not just, hey, let's have a drive and we're going to give out bags of groceries. That helps the individual for a week. But I'm wanting us to dig deeper and to look at how do we change the system so that we're not perpetuating poverty? How do we get to a point where we're not when we look at all of the different funders, how much of that has been toxic charity? How do we get to that point where we're actually helping people to move out of poverty? How do we get people to move out of generational poverty? I think those are the things that will make it different for us going forward, is to dig deeper and to try to have systems change. So, of course, I guess I would say that I lead with integrity, and at the same time, I recognize that sometimes when people see faith, they have negative connotations. Some people have positive connotations. For me, it just means that I lead with integrity, and I think it will be important for us to partner with our faith communities because they have a lot to give, and lots of people get their messages through their faith communities. And so we need to think through how can we partner with the faith communities that are actually in those neighborhoods where we want to affect change. I think that will be something that I will focus on. But beyond that, for me, it's just being an authentic leader who leads with integrity, and I am truly a servant leader.
Anything else you can think of?
I'm super excited to be in Forsyth County and to have opportunity to work at United Way of Forsyth County, and to work with the people who live and work here in this community, and to have an opportunity to actually affect the trajectory of poverty for so many people in this community. So I'm super excited and happy to be here.